Всім доброго дня.
Hello, everyone.
Нема різниці.
Oh, it doesn't matter.
Так, мене
Yes,
звати
thank you.
Скрипник Євген Васильович, я
Okay,
юрист,
so my name is
психіатр,
Yevhen
журналіст
Vasilievich
та говорить. Я
Skrypnyk.
сьогодні
I'm a
просто до
psychiatrist,
вас сьогодні
MD from
спеціально
Gluchev, Sumy region,
на своїй
and
машині,
I've come all
щоб
the way through
розказати
here
трішки за
today,
психічний
driving my
розвиток, який
car,
відбувається під
to
час
tell you a little bit about
війни.
mental health
Я
disorders
практикуючий
developing
лікар-психіатр,
during
20 років
wartime.
пропрацював
I am a
в армії,
psychiatrist and
2015
practitioner. I have
рік
over 20 years of
працював
experience
медичним
working at the
директором лікаря
regional
психіатра
psychiatric
і
hospital. I worked as a medical director, as a psychiatrist, as an
веду блог
administrator,
де мене там
and I
150
also have my own blog on Instagram with
дехто з вас, мабуть, знає.
150,000
Дякую.
followers, so I think some
Приємно.
of you know me already.
І
Thank you so much.
у нас сьогодні, так
So,
розумію, захід
today, our today event
ПТСР. Так?
is
Але я хочу
dedicated to the
розказати, що
topic
нас
of
сьогодні
PTSD, but I'm
ПТСР
here to
називається
tell you
ПТСР не
not
так,
just
як
about
інші
PTSD
розлади.
during wartime, but also about
Хочу
other
почати з
war-related mental
того,
health
що...
disorders. And let me start.
Вибачаюсь.
I'm
Хочу
sorry.
почати з
So let
тої
me start
фрази,
with
яку
this
використав
very
Віктор
famous
Франка, хоча,
quote
ви всі
by
знаєте, що
Viktor
він
Frankl
весь
I'm
свій
always
туги Віктор
using.
Франко
You all know
провів
that
в
he
10-х
said
роках
it
неволі, він
when he was a
використовував, але
prisoner
тим не
in a
менше до
concentration
нашого
camp,
часу
but this saying
дотожна
is
і, в
still
принципі, ми себе
relevant for
використовуємо. Так? Люди,
our
які
time and can be
чекали,
used
що
now.
війна
So those people
закінчиться
who
швидко, вони швидко
wait
здаються,
for the
тому що
war to
є
end
мало
soon,
надію.
they give
От
up
зараз
quickly because
місяць,
they have
два і
hope.
все, і потім
They
настав
expect
стрес,
everything to
більше
end
виникало,
just in a
більше
month or
психічних
two,
порушень.
but then
Ті
they
люди, які
develop
думають,
higher
що війна
stress and develop
не
more mental
закінчиться
health disorders.
взагалі, також
Those who
швидко
think that the
здавалися.
war
І ті
will
ж
never
самі
end
люди, які
also give up quickly.
працювали і
But
жили
only those
тим
people
життям,
who
яке раніше
continue
було.
to
Робили
work to
ремонти,
live their own
донатили
lives,
на
doing
потреби
home
армії. Хто
renovations,
воював, хто
donating
воює,
to
так,
the
тобто
armed
робили
forces,
ту роботу,
fighting
яку
on the
потрібно
battlefield.
робити тут і
Only those
зараз.
people
І
don't
вони,
give up.
в них
People
стрес
doing
менший,
things
вони
needed here and
більш-менш
now
не піддаються
experience
на,
less stress, so
на
they are
стресові
more or
фактори.
less resilient to stresses.
Так, що таке
So,
стрес? Так? Стрес – це в нас
what is stress?
нормальна реакція
Stress
на
is a
ненормальні
normal
умови. Так,
response
ми всі
to
знаємо. Для
abnormal
чого нам взагалі стрес?
situation.
Під час
We
стресу у
all
нас
know.
виділяється
Why do we
гормон, який
need stress?
називається
During
адреналін.
stress, our
І завдяки
body
цьому гормону ми з вами
releases
краще
adrenaline
рухаємося,
hormone, and
краще
thanks to this
говоримо, краще
hormone, we
бігаємо
are in a
і
better position
досягнення
to
в
move, to
спорті,
speak,
якісь
to
там хвилювання
run.
перед
We
екзаменами,
may
ми
achieve
краще
some
здаємо під час
athletic
стресу, наш
results.
відновлюється поляний
We
тиск,
show
ми
better
краще
academic performance
додивимося,
during
тим самим
exams.
ми краще
Our
думаємо і
blood
досягаємо
pressure
цього стану.
increases, blood
Але коли
flow
в
to
нас
our brain
стрес
increases. It's easier for us to
достроково
think
так
and to
виникає,
achieve.
то в нас
But
виникає
when we're exposed to a
виснаження
prolonged
високої
stress,
важливості і
we
виникають в
develop
нас, на жаль,
compensate, we
захворювання.
exhaust our
І війна –
compensatory
це
capacities,
такий
and we develop
надмірний стрес, який
disorders.
призводить
Actually,
до
a war
виснаження
is
нашого
an
мозку,
overwhelming
виникають в
stress
нас
which
фізичні
exhausts
виснаження.
our nervous system
І
and results in mental health disorders.
у війну, так, нас з
So
кожним
during the
днем
war,
кількість психічних порушень збільшується, і я вам
the
скажу так,
number of
що
mental health disorders
коли я
increases with every
пішов на роботу
day.
психіатром,
And to
я
be
взагалі
honest,
не
when I
знав,
started
що
my career as a
люди мене
psychiatrist, I
називають
didn't even
психіатром, всі
know.
думали, що психіатр тільки лікуючий шизофренію, там, деменцію і
I
всяке
didn't.
остальне.
Actually, other people, my
Але з
patients
кожним
didn't even
роком,
know.
з
They
кожним
believed the psychiatrist
здоров'ям,
was here to
і
treat only
особливо після початку
schizophrenia and
війни,
dementia.
кількість людей,
But
які
during the
звертаються до
recent years,
психіатра, збільшилася
especially after
просто
COVID
в
pandemic and
сотні
after the
рази
beginning of
збільшилась,
the
так?
war, the
І
number of people seeking
по
psychiatric
дослідженню
support has
Інституту регіонального здоров'я, що
doubled or even
приблизно
tripled.
25%
And
людей, які
according to the
будуть потребувати
WHO, we will
допомоги
soon have over
психотерапії.
20% of people
І
requiring
найпоширеніші
psychological,
захворювання під
psychotherapeutic, and
час війни –
psychiatric
це
support.
депресія.
And most
У
common
деяких
mental
населених
health
пунктах це
disorders
психологічні
developing during
розлади
war
і
are
гострий стрес
depression, major
і
depression,
депресія.
anxiety disorders, acute stress
Дивіться,
disorder, and
які в нас можуть
PTSD.
виникати
Okay,
внаслідок гострої
so
реакції на стрес, дивіться, гостра реакція на стрес виникає внаслідок
what can happen
сильних
as a result of
травматичних
acute stress response?
чинників.
Acute
Що
stress
сильні
response
травматичні чинники?
is
Це,
our
наприклад,
response to
приїзд
severe the traumatic factors. Traumatic factor is not just moving to other area, you change in school or retiring. It's something related to life threat. It's a sexual assault. It's a loss of your comrade. It's a deadly explosion, fatal explosion, apartment block collapse. So it's called distress, overwhelming traumatic stress. And over the course of the first 2 or 3 days, all people experience traumatic stress, develop acute stress response. All people, it's absolutely normal. Basically, acute stress response, it's not a pathology, it's not a disorder, it's not included in the ICD or DSM. This reaction is typical for all human beings, healthy human beings. But for healthy people, it lasts only for 2-3 days. This acute stress response may result in freezing or may result in agitation. When we freeze during stress, we cannot talk, we withdraw within ourselves, we shut down, or we may get agitated, screaming, running around, shouting. It's typical for all people, agitation or freezing. But if this response is excessive and it lasts for longer than 2 or 3 days, we diagnose a condition called acute stress disorder. Acute stress disorder is included into ICD and it developed 2-3 days after overwhelming stressor. It's called acute stress disorder F43 according to ICD-10. So it lasts between 2-3 days and 1 month. Symptoms of acute stress disorders are very similar to symptoms of PTSD. Flashbacks, intrusive reminders, high level of start reflexes, sleep disorders, anxiety, aggression, agoniia. So this is acute stress disorder. If acute stress disorder lasts for over months, then as you all know, we develop PTSD, post-traumatic stress disorder. So if it lasts less than a month, we diagnose acute stress disorder. If it lasts for over months, we diagnose PTSD. PTSD, as you know, can happen both in military as a result of loss of comrades, death of comrades. Often our guys report that the source of their PTSD is a loss of their comrades. For example, they were having a meal together, then explosion happens and they see this meal on the ground, on the street. And very often guys fighting on the battlefield, they cannot go on a leave to to have a barbecue because the barbecue smell reminds them of a smell of burning flesh. It's post-traumatic stress disorder. I had another case where a guy came home on a leave and his mom fried a chicken. She used a gas torch to fry this chicken and he immediately experienced flashback because this smell of a fried chicken reminded him a smell of burning hair of his comrades. So it was a trigger for him. So treatment of acute stress response. Very first response we all developed normally. First of all, we need to ensure basic safety because we all know that our basic need is safety. So we need to bring a person to a calm place, to a bomb shelter, as away from a destroyed building, away from a trench where a shell exploded, etc. Then we use so-called grounding techniques. Butterfly hugs, you've all seen it on TV. It can be Jacobson's relaxation technique, contraction of our sequential construction of our muscles, top to bottom. We tension them for 20 seconds and we relax them. So when we tension our muscles and then relax them, our body relaxes. It's this technique perfectly works before sleep. Your muscles are in tension, but then they relax, and it's easier to you to fall asleep. It can be box breathing. You all know what the box breathing is. Inhale, stop, exhale, and hold. So we do it for 4 seconds, and so oxygen has enough time to reach our brain, reach our muscles, and then we exhale CO2. But when we have this superficial, shallow breathing, the oxygen builds up, but oxygen does not reach muscles and blood because the body doesn't have enough time to release CO2, while our red blood cells must deliver O2 and release CO2, but it doesn't happen because of this rapid shallow breathing. This is actually the reason why sometimes we get dizzy when we are stressed or anxious, because our body doesn't have enough time to deliver O2 to tissues. If it's freeze response, we need to flex hands and press our thumbs. Also, we can use our thumbs to massage an area over our bruise while talking to a person. If a person is agitated, we must not hold the person. We must let a person to shout, to scream, or to run. So this is acute stress response. Now let's wind it 2-3 days forwards, and the symptoms of flashbacks and agitation prevail. Then it's acute stress disorder. It develops, as I mentioned, between 3 days and 1 month after potential traumatic events, and its symptoms are similar to symptoms PTSD. Acute stress disorder treatment includes CBT, cognitive behavioral therapy, dialectical behavioral therapy, exposure therapy, and the purpose is to process triggers and worries of our patient. Here you see some of the diagnostic criteria. Intrusion symptoms, negative attitude, dissociation symptoms, and avoidance symptoms. Next. So between acute stress disorder and PTSD, I want to tell you about so-called adaptation disorder. What is adaptation disorder? If person previously used to have a normal life, used to travel abroad, the person traveled abroad, moved to some other place, maybe changed the school, or maybe retired, so the environment has changed somehow. It may also include divorce or separation, for example, because sometimes divorce or marriage is also a significant change of environment. Sometimes these dramatic changes may result in adaptation disorders. So previously person was okay, but now something has changed and person becomes prone to crying, become anxious, experiences sleep disorder. It normally develops over the course of the first 3 months over stress, not overwhelming stress like in case of acute stress response, after a life-threatening incident, but after some changes of living environment, and it may last up to 6 months. Adaptation disorder. Normally, adaptation disorder resolves spontaneously, but it can all be also treated by psychotherapy, no, by counselors. We don't usually use antidepressant pills in this case because it's a transient response, but if you don't treat it, if you don't process it, it may develop in other mental health disorders such as depression, panic attack, anxiety disorder, etc. And now let's talk about our post-traumatic stress disorder. So post-traumatic stress disorder is primarily, well, let me just quote it. Every time when I'm reading the book and trying to turn a page, I once again feel like I'm on the same page where my trauma is described. It doesn't matter how often I'm trying to continue reading, the book always sends me back to this painful memory, leaving me in a feeling of helplessness and fear. So, in post-traumatic stress disorder, at first primary diagnostic criteria are intrusive memories. A person constantly has these intrusive images in their head. For example, explosion, amputation in the comrades, person sees it, person relieves it again and gets re-traumatized every time. So every time when a person faces reminder of a traumatic event, the condition deteriorates. Person experiences the situation and then these flashbacks, this intrusive memory result in re-experience. Sometimes people may feel smell of gunpowder, feel smell of blood, smell of earth. So it's like 3D. You not just see the images and hear sounds. Sometimes you may always feel smells. It's scary, and many guys are affected by it. But once again, not just military servicemen are affected by it. Civilians may also develop PTSD after a sexual assault, after a car accident, basically after any near-death experience during potentially traumatic event. Any traumatic event may result in PTSD. So some PTSD symptoms, constant thoughts about the traumatic event, as I have already mentioned, flashbacks, nightmares, bad dreams. Person may wake up in the night, get up, re-experience a traumatic event again, and these flashbacks may happen both during the night and during daytime. High start reflex. What is high start reflex? Person is always ready to respond. Person is always in tension, ready to run, ready to flee, ready to act. Why? Because during a potential traumatic event, people have near-death experience, so people are ready to face this deadly threat. People are ready to defend themselves. For example, any loud sounds, such sound of a trash truck, any loud sound may become a trigger. A person gets startled. Person is ready to jump on the floor, bend down, run away. It's called high start reflex. And then it's another criterion is avoidance of trauma reminders. What does it mean? People who experience post-traumatic stress disorder never want to talk about their trauma. If you ask them about their trauma, they will avoid such conversations. They will hide any photographs. They will delete social media pages, some memories, dispose of some clothing, discard any reminders. Why? Because any reminder about trauma may result in re-traumatization. And in PTSD, people also experience cognitive decline and mood disorders, emotional numbing, lack of interest to one's enjoyable activities, relationships, etc. By the way, often PTSD patients lose their faith in God, lose their trust in other people. They start to challenge their faith, asking how God could let it happen. And may also experience chronic pains, headaches, diarrhea, and other physical symptoms. According to the statistic, I always say that we only have medical statistics, but no, sorry, there is large lies, small lies, and medical statistics. You all know this saying. So we have our National Healthcare Service, which funds our hospitals, and we input the number of PTSD patients into medical information symptom. But now everyone talks about PTSD, so everyone is diagnosed PTSD. PTSD is diagnosed very frequently, but often it's not actually PTSD. It's depression, it's anxiety, panic disorder. They are just exacerbating during war. By the way, let me tell you about another thing. During the early stage of the war, much less people people came to psychiatrist. All my girls with panic disorders suddenly believed that they is magically cured because everyone mobilized themselves because of the war. Who would care about some loss of consciousness or other panic attacks when there is actual life threat? So people mobilized their resources, moved to western part of Ukraine, moved abroad. They experienced no panic attacks and they thought that they cured magically. But then everything returned with a double force. So according to our statistics in 2021, we have slightly over 3,000 patients, 2022 7,000 patients, 2023 amidst the war we had 12,000 patients with PTSD, and in 2024 as of March we already have 3,292 patients. Of course, these numbers are not really reliable, but we indeed have a lot of PTSD cases both among civilians and among military. So how to treat PTSD? According to the order by the Ministry of Healthcare dating back to 2015, we have diagnostic and treatment criteria. So the first line method is cognitive and behavioral therapy, psychotherapy, and it's dialectical behavioral therapy and EMDR. EMDR is eye movement desensibilization and reprocessing. A therapist works with a patient and the patient is supposed to move their eyes. It stimulates the brain and helps a person to process these trigger memories. During this eye movement, a person starts to talk about sexual assault, about explosion, about car accident. So it's easier for a person to process this emotional stress, this trauma that happened back then, and after a person is able to talk about it, the symptoms reduce. As for PTSD treatment, maybe you've heard that in Ukraine we have a lot of fake drugs. Adaptose is my favorite topic. Befren, Persen. Well, PTSD is a disease. It cannot be treated with bioactive supplements that have no evidence base, but unfortunately widely sold in our pharmacies. And volunteers spend a lot of money to deliver these fake drugs to the battlefield. I just watch my Facebook profile and I see my friend sending 3 boxes of glyphosate bioactive supplement to the front line. It would be much more efficient to send their box of candies. It's not evidence based. It's not used in the United States. It's not used in Europe. Why would you spend money on drugs that do not actually treat anything? So we have reputable medical organizations, FDA and in America and NICE in United Kingdom. So they have proved that antidepressants, mostly paroxetine and sertraline, are efficient in PTSD. This is a first-line pharmacological treatment. So when our patients have PTSD, we must prescribe sertraline and paroxetine. Paroxetine if patients have small body weight, and if patients are overweight, then sertraline is a drug of choice because sertraline does not affect body weight. Now, in addition to paroxetine, NICE also recommends mirtazapine, another antidepressant drug efficient in PTSD, but patients often refuse to take it because it results in increased body weight when weight gain. Around 70% of people exposed to traumatic event will recover and will experience no consequences and no PTSD symptoms. Around 30% of people affected by a potential traumatic event will develop PTSD, 30%. And some of them will experience chronic course of disease, some may develop disability and will need specialized help. But most people out of the 30% will cure spontaneously, but it's still better to seek professional support and treat it. But unfortunately, people don't seek professional help. It's a big issue. Many military servicemen don't seek professional help because there is a lot of stigma around it. The guys think that they are strong, they are fighters. They feel ashamed to seek help. If civilians are more or less open to seek professional psychotherapeutic help, military servicemen usually don't like doing it. It's very difficult to convince them, and it's actually a problem for us. Okay. And also, let me add another point. Often they receive wrong treatment. Unfortunately, often they try self-medication with drugs or alcohol. It's another PTSD-associated issue. And let me say a few words about so-called complex PTSD in ICD-10. In its effective version of ICD, there is no complex PTSD, but in ICD-11 we do have complex PTSD. Complex PTSD is the same PTSD that develops as a result of several traumatic events, for example, sexual assault, captivity, several explosions. For example, a guy is fighting, he loses a comrade, develops PTSD, he's not hospitalized, he keeps fighting in the battlefield, and then he experiences another traumatic situation. He continues to fight, and eventually he develops complex PTSD. So prolonged exposure to traumatic situation results in complex PTSD. Is complex PTSD different from regular PTSD? Yes, it is. People with complex PTSD often develop personality disorder. It's much more difficult to treat, and it's basically a lifetime condition. If we can treat PTSD, complex PTSD is much more difficult to treat. Personality disorder develop, a person loses faith in trust in other people, faith in God, becomes irritable, may become aggressive, denies authorities, etc. So basically it's called complex PTSD, and often military servicemen with complex PTSD may have suicide attempt. 25 to 30 people may attempt suicide. These figures are really high. So, I've already mentioned it. Now let's talk about generalized anxiety disorder, GAD. I think around 30 people have it. It's most common mental health disorder we may develop. And of course we may develop it because of the war. Generalized anxiety disorder is characterized by worrying about everything. Person wakes up and already starts thinking about their heartbeat. Where is my husband? Where is my child? What will happen if my child doesn't wear a hat? What if I cook breakfast 30 minutes late? A person is always worried, is super controlling, and this anxiety lasts for over 6 months. If it lasts for over 6 months, we diagnose generalized anxiety disorder. It's characterized by muscle tension. Why generalized anxiety disorder patients often complain of muscle pains? They come to neurologist, they treat osteochondrosis, but actually the reason behind it, it's anxiety, because when we feel anxious, we flex our shoulders, muscles are tension, and they start to ache. And person thinks, well, I feel muscle pain, must be there is something wrong with my neck. They try to treat cervical osteochondrosis, while generalized anxiety disorder progresses. So treatment, the first line of treatment is CBT, cognitive behavioral therapy, and antidepressants. Once again, not the fake drugs, but evidence-based medications. Paroxetine, duloxetine, fluoxetine, sertraline, and other reverse serotonin intakes capture inhibitors. Diagnostic criteria: symptoms lasting for over 6 months, worrying, rumination, slight fatigue, sleep disorders, etc. So people always worry about everything. People always try not to miss anything. When I receive patients with generalized anxiety disorder, I always ask them, where is your husband now? He's at home doing this and that. Where is your child? At school doing this and that. Is your phone charged? Yes, 100%. So these people try to control everything. But unfortunately, we cannot control everything in our lives. So our school kids sometimes will develop a runny nose. And then just imagine anxious mother will think it's my fault. I didn't control. I didn't do enough. I opened window. I missed something. So mother gets even more anxious and even more controlling to prevent this from happening again. So this is kind of a snowball effect. I'm anxious, I can't control anything, something happens, I'm getting even more anxious and even more controlling, so my anxiety increases. Panic disorder. It's another disorder very common during war. It exacerbates during war, and it's actually more common than PTSD. Panic disorder is characterized by panic attacks, episode of elevated heartbeat, of rapid heartbeat, anxiety, fear of death, fear of losing, going unconscious, this kind of animal terror. Many patients say, doctor, you've never had panic attacks. How do you know what it is? So what's panic attacks? Just imagine you walking across the street and a car is driving towards you at a high speed. You feel like you're about to die next minute. Why? We see a moving car, our body releases adrenaline, but a person with panic attacks doesn't see a moving car, but their body releases the same chemicals, adrenaline, and a person is feeling this extreme fear of death. So panic attacks do not require any treatment. Every person may develop panic attacks. It may happen due to anxiety, due to excessive worry, due to lack of sleep. But when panic attack happen frequently, when we pay attention to it, when we start to be afraid of it, when it controls our life, when we're afraid to go to a grocery store, when we expect next panic attack, it's called a panic disorder. Actually, during a panic disorder, you may never experience panic attacks at all. You're just afraid of it. You avoid various things. You don't go outside. You're still afraid of experience you last had 2 years ago. It's called panic disorders. Many people often confuse panic attacks and panic disorder. Many people tend to think that panic attacks are something infrequent. Panic disorders is when you're having a lot of panic attacks. No, panic disorder is when panic attacks affect your daily function. The first line of treatment is a cognitive behavioral therapy, psychotherapy. Then, once again, antidepressants, selective reverse serotonin intake inhibitors prescribed by a psychiatrist. Bless you. Let's go next. Major depressive disorder. Major depressive disorder is top 2 after anxiety disorder. Very common during the war, large depressive episode. Many people ask how it's different from laziness, from sadness, from fatigue. Depressive episodes are characterized by clear criteria. Over 2 weeks of being in a bad mood. Depressed mood for over 2 months. And loss of interest in one's enjoyable activities, so something you used to like, you don't enjoy anymore. Increased or decreased appetite, overeating or eating insufficiently, loss of sleep disorders, agitation or inhibition, feeling of low self-worth or unreasonable feeling of guilt. Cognitive decline. By the way, patients frequently present with bad memory, with compromised memories. They treat their brains, they treat their vessels, but it's a reason, it's just a depression. It's a diagnostic criteria. Cognitive decline, problems with concentrations and decision making, recurrent thoughts about death. It's less frequent, but mostly these are most common symptoms of depression. This is a so-called Beck triad. I think you've heard about the Beck's triad. These are classic signs of depression. Feeling of low self-worth, I'm wrong, I'm broken, I'm not smart, I'm not sexy, I'm bad mother, I'm bad wife, I'm a bad professional, I don't do enough, my friends are better than me. It's called the feeling of low self-worth. The second one is there is something wrong with people. People are evil, there is a war in the country, everything's bad, prices go up, everything goes wrong, the world is broken. So it's the second one. And the third one is a lack of future plans. So I'm bad, people are bad, I don't have future. It's called the backstride, a classic clinical picture of a depression. Separation anxiety disorder. It's also anxiety disorder we develop when children go, for example, to study in other city or go abroad. So there is a separation, and separation may result in a separation disorder. It's quite common during the war. As for displaced people are also very prone to adaptation disorder. We've already talked about it. And normally it lasts up to 6 months. I've already mentioned it. If it's less than 6 months, it's okay. Over 6 months, it's wrong. I used to receive a lot of calls from refugees. Most of them will adapt during first 6 months, and kids usually adapt far faster than adults. And there is another curious disorder, adrenaline addiction. Sometimes people who have experienced these explosions are waiting for a next siren to go off. They're waiting for a next explosion, for a next fire of air defense systems, for next launches of interceptors. Many people are afraid to talk about it. People think that there's something wrong with them if they feel it. People feel fear, but at the same time they enjoy this fear. This fear brings pleasure. All this disorder also may develop. And so how to mitigate the stress impact, the war-related stress impact on human health? First of all, we have a lot of sources of information. Why we are more prone to stress disorders over the last decade? Well, we consume too much information. We are overwhelmed by this information. Looking at me, talking to me, but you all have mobile phones with various social media, TikTok, Facebook, Instagram, newspapers, websites. No, we have telegrams. They are competing with each other to be the first to report on various events. So we know what's happening right now in our country, in the United States, in Japan. We know it, we're trying to control it, and we are overwhelmed by this information. It's harmful for us. So plans for the future, we need to make plans, because even if we don't go to a seashore in Turkey, we need to plan this vacation. We need to think about it. Where would we go on vacation? What are we going to do next? We need to plan our home renovations, plan our future lives. Even if we know that it may not work, we need to plan, because when we plan, our body develops dopamine and serotonin, which improves our condition. We need to stick to good sleeping practices, spend time with our family, with our friends, talk about our worries, about concerns about explosions, etc. And then physical activity. You know, our ancestors were born in cages, running around all day, hunting mammals, so we need to be physically active. That's it.
Дякую,
Thank you so
Євгене.
much.
Дивіться, у нас
Thank you,
такий
Yevgen.
нюанс зараз. У нас буде міжнародний спікер зараз.